In barely a month, the Enhanced Games are happening in Las Vegas. And if you haven't seen our first video on this, go watch that one first. Links in the description, links on the screen, Ronnik's gonna put it everywhere. But the single most common question that we got after that video and that I had when making that video was, what exactly drugs can these athletes take? But the answer is a lot more interesting than you think, because when people hear Enhanced Games, they think it's a free-for-all. They think testosterone, D-ball, Deca, you know, the usual suspects. But when the rule is FDA-approved substances only and no drug testing, the actual pharmacologic toolbox available to these athletes is way, way more nuanced. Because yes, they have access to things like EPO, insulin, growth hormone secretagogues, HIF stabilizers that trick your body into thinking it's at an altitude, Adderall, modafinil, aromatase inhibitors, drugs that most people have never even heard of. But then we have compounds that are wildly popular in the fitness community that are totally off the table. Tren, BPC-157, cardarine, some of the most effective performance enhancing substances on the planet, banned. Not because they're banned by WADA, but because they were never approved by the FDA. What's up, Lab Rat Legion? My name is Dr. Alex Tatem, and I'm a board-certified urologist and fellowship-trained men's health specialist. I prescribe many of these exact medications we're talking about today for a living. And today, we're going compound by compound, category by category, through everything that's allowed, everything that isn't, and the absurd ironies in between. Quick question before we dive into it. Which drug on the WADA ban list were you most surprised to learn that it's FDA approved? Drop it in the comments down below. I bet most of you are going to say insulin, but stick around, it's gonna get weirder. Let's go. So a quick refresher on the rules. The Enhanced Games say FDA-approved substances only, prescribed by a licensed physician, disclosed to the organization. No traditional drug testing, medical screening and biomarker monitoring instead. So the dividing line is FDA approval, not safety and not efficacy. Not, is this a good idea? Purely, does this molecule have an FDA-approved indication somewhere in the United States? And that one bureaucratic checkbox creates some of the wildest contradictions in the history of sport. Let's start with the obvious. Anabolic androgenic steroids. We're talking testosterone in almost every form you can think of. Cypionate, enanthate, propionate, undecanoate, gels, patches, pellets. The king of anabolics. The backbone of every enhancement protocol. Multiple FDA-approved products is absolutely on the table. Next is nandrolone or Deca. The branded product was discontinued, but the molecule still has FDA approval. It's Schedule 3 and widely available through 503A compounding pharmacies, and it's prescribed every day. It's one of the most joint-friendly anabolics in existence, has a favorable anabolic to androgenic ratio, and bodybuilders have been running it since your grandparents were in high school. Absolutely fair game. But, fun fact, only with its decanoate ester, not phenylpropionate, because NPP never received FDA approval. Next is stanozolol, aka Winstrol, and it's the same situation. The brand name product was discontinued, but the molecule is still approved, still compounded, and still prescribed. It's famous for being the drug that got Ben Johnson stripped of his 1988 Olympic gold medal, and there's a certain poetic irony in it being perfectly legal at the Enhanced Games. Full circle. Next is oxandrolone, aka Anavar. Oxandrolone was FDA approved historically for weight regain after surgery or for chronic infection. It's one of the mildest oral steroids and bodybuilders love it. Your liver may have opinions, but it's not as bad as some other oral options, and it's totally legal to be compounded in the United States. And then we have oxymethylone, aka Anadrol, FDA approved for anemia. It's one of the most powerful oral anabolics ever made. It's basically a freight train with a prescription label. It's also one of the only oral steroids to actually be linked to liver cancer, but that's a conversation for another day. Then we have fluoxymesterone, aka halotestin. Extremely androgenic, minimal mass building effect, but powerlifters love this for its pure aggression and strength. It's absolutely brutal on your liver, like your liver is gonna wanna file a restraining order against you, but hey, you can lift a building on it. And then we have OG oral testosterone, methyltestosterone, Android, Testred. It's an older form of testosterone, but it's still FDA approved. And although I don't think anyone's gonna actually use this because they've got better options, it's technically in play too. And then we have weirder inclusions like danazol, which is a synthetic steroid prescribed for endometriosis. You wouldn't expect it on this list, but again, it's an FDA approved steroid, it's androgenic, and it's banned by WADA. Welcome to the party. And then we have DHEA. Believe it or not, that oral supplement that you buy on Amazon is banned by WADA as an anabolic agent. But because it has an active FDA approval as a prescription vaginal insert called Intrarosa, it's on the table. So yes, a vaginal insert is technically a legal performance enhancer at the Enhanced Games. I couldn't make this up if I tried. Also, shout out to Intrarosa. It's a fantastic product for women going through menopause. Just wanted to throw that one out there for all my girlies. You know, all three of you that got lost and ended up watching this video. But now we're gonna move past traditional anabolic steroids into hormone and metabolic modulators, because believe it or not, the majority of these are banned by WADA because they can have an indirect effect on performance. The first category up for grabs are aromatase inhibitors. We're talking anastrozole, letrozole, and exemestane. These are breast cancer drugs originally that are designed to block testosterone to estrogen conversion. Every athlete on a serious testosterone protocol will probably have to run one of these. And they're all FDA approved, all WADA banned, and they're all fair game. The next category are SERMs, or selective estrogen receptor modulators, including tamoxifen, clomiphene, raloxifene, and others. Clomid is used by every hormone clinic in America to restart natural testosterone production, although most of us who know what we're doing have moved on to enclomiphene. But guess what? They're all banned by WADA, but legal here. And I have a particular bone here to pick with WADA because as a physician who has had professional athletes in my clinic with real male fertility issues, my hands are tied when it comes to treating them. Because if I give them enclomiphene, I might inadvertently raise their testosterone and get them tossed out of their league. There is no pathway for me to find them a therapeutic exemption, and that's a problem that needs to be fixed. Next, we actually have insulin, Humalog, Novolog, Lantus, you name it, they are all FDA approved. WADA actually bans insulin in non-diabetic athletes because it's aggressively anabolic. It drives nutrients into muscle tissue like a fire hose, and bodybuilders have used it for decades. It's also one of the most dangerous PEDs in existence because if you miscalculate your dose, you die. Not feel off, you die. Hypoglycemic coma, game over. But it's FDA approved, so it's theoretically on the table. And then we have blood oxygen enhancers. We're talking EPO or erythropoietin, the drug that defined the Lance Armstrong era. Epoetin alpha, darbepoetin, FDA approved, all for anemia. These massively boost red blood cell production and oxygen carrying capacity, and they're all presumably legal under the enhanced framework. Now we have the more esoteric options like HIF stabilizers, like daprodustat and vadadustat. Recently FDA approved for dialysis patients. These things literally trick your body into thinking it's at altitude, triggering natural EPO production. Simona Halep was banned for testing positive for this exact drug class, presumably fair game here. And then we move on to the IGF-1 arena with growth hormone. We're talking somatropin, genotropin, norditropin. These are all FDA approved for growth hormone deficiency. This is like the Swiss Army knife of enhancement. It can improve recovery, body composition, and strength of connective tissue. Every serious athlete in this space is going to be on it. We also have growth hormone secretagogues like tesamorelin and samorelin. These are all FDA approved or they're available by compounding pharmacies in the United States. They stimulate natural GH production and WADA bans them, but enhanced is going to presumably allow them. But hey, let's just skip to the main event and go straight to IGF-1, which we have in the form of mecasermin, brand name Increlex. This is FDA approved for severe IGF-1 deficiency, WADA banned, but theoretically in play here at the enhanced games. Then we've got HCG, human chorionic gonadotropin, Pregnyl and Novaril. These are FDA approved for fertility, but WADA bans their use in males because steroid users can use it to restart testosterone production and prevent testicular atrophy. It also boosts your own testosterone through its action on the testes. And I prescribe this literally every single day. It's banned by WADA, but it's legal here, and it's actually going to keep athletes safer while they use other compounds. Now let's get into stimulants, because believe it or not, WADA bans stimulants in competition. The enhanced games doesn't. So things like Adderall, Vyvanse, Ritalin, modafinil, these are all FDA approved and all theoretically on the table. Modafinil is apparently huge in track and field for hyperfocus without the jitters, and an athlete could theoretically take Adderall before a 100-meter sprint for the reaction time boost and sympathetic activation. Oh, and how's this for a weird one? We're talking propylhexedrine, also known as Benzodrex. This is an over-the-counter nasal decongestant inhaler, but WADA bans it because athletes have been known to break open the plastic, swallow the chemically soaked cotton inside, and get a massive amphetamine-like stimulant high. It's FDA approved and over-the-counter, but WADA banned. I cannot stress enough how strange this list gets.
Someone watching this will be like
100%. 100%. Yeah, someone in the comment section right now. And now we've got all these other categories that are now up for grabs, like beta-2 agonists, like albuterol. Believe it or not, asthma meds are restricted by WADA because systemic administration mildly improves cardiovascular performance. And then glucocorticoids, like prednisone and dexamethasone, WADA bans them in competition for their pain masking and energy effects. Also, diuretics like furosemide and hydrochlorothiazide, WADA bans them as well as masking agents, and they're all FDA approved and all presumably on the table. Even xenon gas, also known as Xenoview, is an FDA-approved medical imaging agent, but WADA explicitly bans it because athletes, most famously the 2014 Russian Olympic team, inhaled a xenon oxygen mixture to trigger a massive spike in natural EPO production. Now, is an enhanced games athlete going to huff xenon before a swim when they could just take EPO? Probably not, but it's on the table. Now, let's talk about the compounds that are presumably off the table. And this is where the irony really hits you. The first category is veterinary steroids, and we're talking tren, baby, the elephant in the room, or more accurately, the roided out bull in the room, because tren was developed to make cattle bigger before slaughter, and it's never been FDA approved for human use. Check out our video above. Now, it's 3 to 5 times more potent than testosterone at least, and it's phenomenal for muscle building and fat loss simultaneously. It's also one of the most toxic, side effect laden compounds on the planet. We're talking cardiovascular strain, lipid destruction, neurotoxicity, tren sweats, insomnia, tren cough, and let's be honest, if they're going to be serious about the FDA rule at the Enhanced Games, tren's out of the picture. Next is boldenone, aka equipoise. This was developed for horses but never approved for human use. Also out. Next we have mebolarone, aka check drops, a veterinary steroid so potent that it was literally used to suppress heat cycles in female dogs. WADA bans it. It only has a veterinary approval in the United States, and I'm only mentioning it because the use of it in sports is kind of hilarious. But then we get into peptides. Believe it or not, things like BPC-157, TB500, CJC-1295, ipamorelin, thymosin, the darlings of the biohacking community are off the table. If you watch our other videos, you know that we've covered these compounds extensively, links above and below. And generally, these are considered to be safe based on available data. They've been linked to healing, tissue repair, and reduced inflammation, but none of them have FDA approval. And because they're research chemicals, they're off the table. And this is the backwards dichotomy that I mentioned in the last video. Some of the safest compounds we know of, with the best healing profiles, are excluded because of their regulatory status, while hepatotoxic oral steroids and insulin are totally fine. And look, I get it. The Enhanced Games has to do this for legal and liability reasons, but you gotta admit, it's more than a little ironic. But although these are the publicly stated rules that they have since doubled down on in anticipation of the games, James Magnuson, the poster boy of the Enhanced Games, publicly stated in his prep that he included BPC-157, CJC-1295, ipamorelin, and thymosin. These are all peptides that are not FDA approved, so either the rules have changed or the FDA approved rule is more of a vibe. So here's where we get into endurance enhancers that don't have FDA approval. We're talking things like cardarine, which is a PPAR delta agonist that dramatically boosts cardiovascular endurance and fat oxidation. It's probably the single most effective endurance compound outside of EPO, but it was abandoned in development after preclinical studies showed tumors in rodents. It was never FDA approved, and so it's theoretically out. And then we have things like trimetazidine, which is the drug that got Iga Swiatek suspended from tennis for a month and Kamila Valieva banned from the 2022 Olympics. And 23 Chinese swimmers apparently got flagged for it before Tokyo. This is something that optimizes cardiac energy metabolism by forcing muscles to use glucose instead of fatty acids, reducing oxygen demand. It's widely available in Europe as Vastaril, but it's never been FDA approved in the United States. So it too is out. So theoretically, 2 of the most commonly flagged performance-enhancing metabolic modulators in international sport are being excluded. Meanwhile, EPO, which is arguably more dangerous and more performance-enhancing than either of them, is FDA approved and presumably fair game. You can massively boost your red blood cell count with erythropoietin, but you can't take a metabolic modulator that optimizes how your muscles use oxygen. Not because of safety, but because of a bureaucratic checkbox. The pharmacopoeia available to Enhanced Games athletes is truly staggering. Testosterone, nandrolone, Winstrol, Anavar, Anadrol, growth hormone, EPO, insulin, HIF stabilizers, aromatase inhibitors, SERMs, HCG, stimulants, glucocorticoids, diuretics, and even xenon gas. That is a toolbox that would make a research hospital pharmacy blush. But it's not technically a free-for-all. Tren is out, cardarine is out, trimetazidine is out, and believe it or not, BPC-157 is out. The line isn't drawn based on safety or efficacy, it's drawn based on regulatory approval. And the result is a system where some of the safest compounds are excluded and some of the most dangerous are allowed. And that's what happens when your substance policy is built for lawyers and insurance underwriters rather than for doctors and pharmacologists and the athletes that are actually taking them. So is this better than the WADA model? In many ways, absolutely yes. Athletes are going to get medical monitoring, cardiac screening, and longitudinal blood work, which is more than what most underground athletes get. But in other ways, it has a different type of inconsistency. WADA's inconsistency is pretending the system is clean when it isn't. And enhanced inconsistency is having to rely on arbitrary FDA approvals as a meaningful proxy for safety when we know that's not the case. And you know what? At least we're talking about it. At least it's in the open, and at least we're monitoring these athletes and having conversations in public as opposed to in the gym bathroom. And you know what? That's progress, even if it's a little imperfect. May 24th, Las Vegas, 50 athletes, and an ocean of FDA-approved pharmacology. Let's see what happens. So if you learned something, smash that like button. Drop a comment telling me which compound on this list surprised you the most. Subscribe for more breakdowns on popular health topics, testosterone, performance enhancement, and whatever pharmacologic chaos the sporting world throws at us next. I'm Dr. Alex. Stay healthy, stay informed, and as always, proceed accordingly.